Joining me now is Admiral Brett Giroir, Assistant Secretary for Health at the Department of Health and Human Services and Testing Coordinator, of course, for the White House Coronavirus Task Force. Admiral, thank you very much. Well, you just heard your colleague, Dr. Redfield, that if people don't wear masks and social distance, it could be the worst fall from a public health perspective. I know this has been a warning for quite some time. We're getting a lot closer to it, and we have not flattened the curve in a lot of the country. In fact, there are coronavirus surges in hotspots around the country.
So thank you for having me on. So let me just talk with the premise. The number of cases are decreasing around the country, and we have 80% of our jurisdictions in a downward trajectory. The hospitalizations are going down, the percent positives are going down, so we are flattening the curve across the country overall. But as you point out, there are some hotspot jurisdictions that we're implementing our strategies on, and we expect that to turn around. To get back to Dr. Redfield's point, we are all very concerned. We're concerned about every flu season, and we're particularly concerned about this flu season because it will coincide with COVID. But as he said, we know we have effective measures. It has reversed the outbreaks all across the Sun Belt. Wear a mask, watch your distance, particularly indoor crowded areas, and wash your hands with good hygiene. This has been a strategy combined with strategic testing, not shotgun testing, but strategic testing that's really reversed the outbreaks we've had in the Sun Belt.
And the fact that Florida is still seeing increases and that you've got increased death rates. I mean, the concern that people have is where they live in many places around the country, not perhaps the national totals, but there are places around this country. We've seen what's happened in schools in Georgia where kids have gone back without wearing masks and without distancing. You saw the visuals. We know that the public health guidance is not being followed in many places.
So, a lot of questions in there, and that's why I love being on. You hit all the good issues. Mortality is very concerning to all of us. But as I said on your show a couple weeks ago, is that that's what we call a lagging indicator. Now, that's no solace to the people who are losing relatives, but it means the mortality we're seeing today is a result of cases that were 4 to 8 weeks ago. So we expect mortality to go down over the next couple of weeks to follow the hospitalizations and case numbers. Now, the things that could interfere with that is, number one, if we don't do the 3 Ws, wear a mask, watch your distance, wash your hands, or if we can't keep it out of nursing homes. And we're very focused on nursing home strategy because we know those individuals are uniquely susceptible to the ill effects of COVID. And in terms of schools, which was your second part, look, the guidance is out there. We really need to do, number one, the most important thing we need to do is decrease the amount of virus in the community. But secondly, do the same things that we're adapting in the country to what we do in schools. And physical distancing and wearing a mask are absolutely essential. Whether children can pass it to each other as well as adults, I think under 10 probably less, over 10 probably similarly. We can all prevent that by doing the simple measures we talk about.
I want to ask you about a new, I guess you could call him a member of the task force, or perhaps not. He's an advisor to the White House, Scott Atlas, seen at the last 2 briefings when there were no doctors there, none of your colleagues, you or your colleagues from the task force, at least present in the briefing room. And he had said on Fox News things that contradict what you and others have been advising, saying that children can't transmit, that children can't die, among other things. What role does Scott Atlas play, and are you comfortable with someone with his views being a close advisor now and part of the team?
So I've met Dr. Atlas. I've spent a couple hours with him. He is a physician and also a health policy person that was brought in by the White House. I think he's been a very productive member of the physician group. Again, I don't think he's on the task force, but he's certainly working with all of us, Dr. Fauci, Dr. Birx. And we continue to get as diverse input as possible. I don't think he would have said something like children can't die from the virus. I think we're all pretty clear, medically speaking, that the rates of severe illness in children are very, very low, and most children who do have a severe illness have an underlying condition. None of us would say, and I'm a pediatrician, I'm in ICU, that children can't have an ill effect, but the chances are much lower, much lower than adults, and certainly much lower than the elderly. So we have to do that risk in context. Every year, We have tragic losses of children with influenza. I'm not trying to say this is the same thing, but we do know children have a better outcome with the disease than adults. And I think that's the appropriate characterization. I don't think he's ever said something to me that would be children can't die or children can't transmit.
Well, he said it to the American people on Fox News by saying, he wrongly claimed there is essentially no risk of dying for children, but we'll check that.
So, I don't want to get back to whatever happened on Fox or not. I'm just telling the American people that the risks are very low in children, but it's not zero. As a parent, a grandparent, and a pediatrician, I want to make that clear. The risks are very low, but they are not zero. And tragically, some children do die, particularly those with underlying conditions.
I know you're about to announce some major new investments in testing. How rapidly can this be geared up?
So we're continuing to increase the capacity for testing. And I just want to make it clear that we're increasing the capacity for all contingencies. So we will have overcapacity to what's really needed to control the outbreak. But what we're announcing today is that we're utilizing some existing technology, the Thermo Fisher platforms that I've talked about multiple times with everyone, that we do have excess capacity in this, and supporting the matching up of Thermo Fisher with a couple of commercial labs, Sonic and Aegis, that are smaller commercial labs. But we're going to be able to increase testing in the country by well over 1 million tests per week, starting in early September. So again, this is one of the many things. And by September, and I'll just tell you, in the month of September, we expect to have well over 85 million tests available. The capacity, that's not our goal, but available to support the American people and our strategies. And we'll start seeing that shift to point of care testing over laboratory-based testing in the September frame. In October, it'll even be more dramatic.
So you'll have faster results.
Yes, point of care is within a few minutes, and as we talked about, there's no such thing as a free lunch. We want to get the right test to the right person at the right time, and point of care makes sense in a number of situations. In others, laboratory tests make more sense. So we now have developed a system that we can really ideally match the kind of test, the type of test to the situation we need. And for our nursing homes, for example.
And bring down.
For nursing homes.
And bring down the delay in the lab results.
Yeah, the delay in lab
point
results.
Of care, I'm just saying, speeding up the the delays in lab results, which have made many of the tests really useless when they come back, 5 to 14 days later.
And again, both Quest and LabCorp now have turnaround times within 3 days. LabCorp's within 1 to 2 days. We're doing over 90% of our tests in those circumstances within 5 days over the past 2 weeks. So the turnaround time has really been reduced by the technological inputs we've had, but also the expansion of point of care testing. So I don't want the American people to believe that they're going to wait 7 or 14 days for a test in general. They're going to be outliers in local places. But in general, if you do need a test, you fall in the categories of needing a test, even for public health tracing, you're going to get that result within 48 to 36 hours. That's really where we are right now. So don't be dissuaded by that fact or by that non-fact that you're going to be waiting 2 weeks. Yep. Thank you.
Hey there, I'm Chris Hayes from MSNBC. Thanks for watching MSNBC on YouTube. If you want to keep up to date with the videos we're putting out, you can click subscribe just below me or click over on this list to see lots of other great videos.